Part 3. Abdominal Examinations. Introduction. In this video, we will learn on how to perform abdominal examinations in gynecological cases. Equipments. We will need a measuring tape and a stethoscope. Introductions and consent. Start your examinations by introducing yourself to the patient and ask the patient's permission and verbal consent.
Assalamualaikum puan. Saya Dr. Hikmah dari Jabatan Obstetrik dan Gynaecology. Hari ini saya buat pemeriksaan sikit atas puan. Kalau ketika pemeriksaan ini puan rasa sakit atau tak selesa, puan boleh beritahu saya. Boleh puan ya? Terima kasih puan.
Privacy. Pull up the curtain to preserve patient's privacy. Hygiene. Use the alcohol sanitizer before touching patient. Exposure. The optimal exposure should be from xiphostenum to the mid-thigh. However, in order to preserve the patient's modesty, it is enough to just expose her up to the pubic symphysis, which is about 1 inch below the line of pubic hair. Inspection. Begin with inspections of the abdomen. Look for any distension, surgical scar, dilated veins, and comment on the umbilicus or any obvious abnormalities. Do inspections of the groin and mid-thigh area. Next, proceed with palpation. Ask the patient any painful area and start palpating away from the painful area. Begin with light palpations of all the 9 quadrants of the abdomen and followed by deep palpations. In the case of allocating mass, comment on the locations, size and margin, and surface, consistency, mobility, and see if able to get below the mass. Next, proceed with the palpations of the liver. Ask the patient to breathe in and out while palpating for liver border, and followed by liver percussion. Palpate the spleen while asking the patients to breathe in and out, and followed by percussion. Palpate to look if there is any ballatable kidney bilaterally. Put one hand in deep palpations at the upper quadrant and attempt to ballot the kidney by using the other hand from the back. Proceed with shifting dullness to look for ascites, and you may proceed with fluid trials if there is presence of gross ascites. Palpate both inguinal area and supraclavicular area for lymphadenopathy. Auscultations. Auscultate bowel sound and listen for any bruit over the mass. Complete the examinations by doing vaginal examination, which include speculum and bimanual examinations, and also perectal examination. Cover patient and thank for her kind cooperation.
On inspection, the abdomen is mildly distended at the lower part. There is presence of prominent vein at the right lower quadrant. The umbilicus is centrally located and inverted, and there is no presence of surgical scar. On palpation, There is an abdominal mass arising from the suprapubic area, which equals to 18-week size of gravid uterus. The mass is non-tender, smooth surface, have well-defined margin, restricted mobility, cystic inconsistency, and able to get below the mass. There is no hepatosplenomegaly, no ascites, and no inguinal lymphadenopathy. On auscultation, there is normal bowel sound and absence of bruit over the mass. In conclusion, the mass is most likely to be ovarian in origin.